Uganda declared the end of its 2026 Ebola outbreak on July 28th after completing the required monitoring period without detecting new transmission. The outbreak recorded 20 confirmed cases with 15 infections imported from DRC. However, the DRC outbreak remains active, making preparedness critical, especially along the Uganda-DRC border, where movement of people and trade can increase the risk of importation.
We want to thank so much AHF for this gesture.
This is why equipment donated by AIDS Healthcare Foundation to the Ministry of Health being received as a preparedness measure, not because Ebola is still present in Uganda, but to ensure the country can respond quickly if another case is imported. The equipment will strengthen the National Reserve and support health workers with the materials required for infection prevention and control.
We are donating test kits for hemorrhagic fevers, Ebola and other hemorrhagic fevers to the Ministry of Health to be able to continue with the surveillance for the Ebola. The donation is worth 144 million shillings. And we are hoping that these reagents and these test kits can be able to support the ministry in terms of testing people along the border with DRC, as we receive donation of reagents and supplies to support the surveillance of Ebola in Uganda. As we are all aware, Uganda is Ebola free, but we continue to do surveillance, and partners are continuing to support us in this surveillance such that we keeping Uganda free.
Health authorities therefore urge Ugandans travelling to DRC to remain vigilant, avoid contact with suspected cases or contaminated body fluids, practice hand hygiene, and promptly report suspicious symptoms.
We continue to do cross-border surveillance at the border between Uganda and DRC, and we urge the people to really be vigilant, look out for any people with signs and symptoms of Ebola that we have put out as Ministry of Health on our website under different areas that we have been on, but also at the same time we also urge our clinicians to really have very high index of suspicion as they treat these patients, such that we can continue being vigilant to continue surveillance for Ebola.
Uganda has battled Ebola several times, including major outbreaks in 2000, 2007, 2011, 2012 and 2022.